Good morning and thank you for tuning in today. My name is Janet Calderwood. I'm a registered dietitian. I want to welcome you to the Dietitian on a Mission. It is always a pleasure to have the opportunity to speak and give you information and certainly to provide you experts that I know and really respect that come and be a part of this show to also deliver to you excellent information, because we know that there is a lot of health information around, there's a lot of opinions about things, but we know that we've got to stick to the facts, and that's what we want to share with you today. Some real hard facts about Alzheimer's disease. Dr. Mary Lewis is with me today. Thank you for being here with me again in the studio.
My pleasure, Janet. Nice to be here.
It's always a great opportunity to tap into your knowledge, and and we are probably talking about something that's really near and dear to both of our hearts, is Alzheimer's awareness and dementia awareness. And I guess my first question to you would be, can you help us understand, okay, we've heard dementia, and then you hear Alzheimer's, and sometimes it's, when you look at diagnoses, they have two diagnoses. They have Alzheimer's and then they have dementia. First of all, can you help us to understand the differences and similarities between the two?
Dementia is the broad term for memory loss.
Okay.
And sometimes the diagnosis is memory loss, and they don't really want the word dementia on their medical record, but memory loss is the same thing. But dementia has many causes, and one of the causes is Alzheimer's disease, and that's where the brain has something called amyloid plaques in it. So there's little blocks in the nervous transmission in the brain. Mm-hmm. So that's Alzheimer's disease. It's a gradual thing, and maybe some genetic component to it. Mm-hmm. And so, yeah, we have gradual progression of the disease. So there's early memory loss and it gets worse. Then there's something called ischemic dementia. Mm-hmm. And that would be somebody who has not really a stroke, but has little blockages in the blood vessels. And in an MRI, an exam of the brain, actually, they'll see one particular artery that was there and then it's gone. So not really like a stroke, but there's an area of the brain that gets blocked. So that kind of dementia will progress, but in steps. Okay. So it's as a vessel gets blocked, the disease progresses.
Let me ask you a quick question while I am remembering it. Years ago, wasn't it true that they thought that for someone to be diagnosed with Alzheimer's that you have to look at their brain after they were deceased?
Yes, we really don't know exactly what causes Alzheimer's disease. We do know that if we could control cardiovascular disease, we could slow the ischemic disease process. And actually, we've had 100,000 fewer deaths from heart disease from 2016 to 2017. Mm-hmm. So we're doing better on that. But as far as Alzheimer's disease, the number has gone down, but the percentage has the number has gone up, the percentage has gone down. So somehow we're doing better on that too. We don't know the cause of Alzheimer's, and we don't know the cause of Lewy body, which is another type of dementia that happens in younger people in their 20s to 40s.
Oh, wow. Now, and of course, when we're talking about, you said that dementia is a broad term, and then you have the ischemic dementia, and then Alzheimer's. Is ischemic dementia the same as vascular dementia?
Yep.
Okay.
So that is related to ischemia, or lack of oxygen, or lack of circulation in the blood vessels. So that's a good point. It's vascular.
Okay. So vascular dementia, I've definitely seen that diagnosis quite a bit. And again, I mean, it's something that we're hoping to help educate you, and you probably know someone, maybe have a loved one that has some form of dementia, and some understanding, I feel, will help you be able to manage symptoms and educate your loved ones more effectively about what expectations they can have for
the amount
someone.
of care someone's going to need, and to keep the person safe, and to be aware that this is going to happen. It's kind of a sad prospect, but something, if somebody is forgetting, then we start to worry about them. Something like they're forgetting a lot of people's names.
Yes.
That bothers a person. They don't like that.
Yeah.
And, you know, they'll mention that sometimes.
Okay.
I'm forgetting some names. And that's an issue. We all have some of that sometimes. You know, real difference in the memory, early
I'm glad
memory.
I didn't forget your name when I opened the show.
I almost forgot yours.
That would be, I mean, it's true
nothing
though.
really
It
to
is
laugh about,
something
but-
that it seems like we all at times can be forgetful. I guess my first question would be, well, how do you know when it's really a problem?
The difference is that remembering what a key is called is one thing, but forgetting what a key is for,
Okay.
that's dementia. So you know,
Okay.
you know something, but you don't know what it's for anymore. That, you know, that's really worrisome. What is this key for? It's
Sometimes I see that frequently in, you know, I work with the aged population, and sometimes people do forget what to use a fork for, or a knife or a spoon
or
or
they put the
something.
glasses on wrong, or something like that.
Something like that. Okay.
Those are kind of early signs, along with executive functions, meaning they could handle their checkbook fine
Okay.
before, and now they can't. They could sign onto a computer, and now they're forgetting and not making sense of a computer.
Well, and plus there's so many password issues these days. I mean, we all forget our passwords. So just, it sounds like what you made it clear to me is understanding it's okay to forget something, but don't forget what it's for.
Yes.
So, okay. Now, you mentioned that there's no cure for dementia, and so my first thing would be is if we can just maybe take our audience, our viewers, through the steps of what we can expect with people that have this this disease. I guess my first question is, when somebody has dementia or Alzheimer's, how long does this last?
It can last a long time, and you know, it has something to do with how high functioning the brain is to begin with.
Okay.
So people that are highly educated have well circulated brain, have a well stimulated brain, and it's hard to know that they have dementia because they have other areas of the brain that can cover for them. So
Okay.
you ask me what the date is, and I have dementia, and I can figure it out sort of pretty good because it's April, and you know, I can figure out the date. I can look at the newspaper or something, and I don't have to just know it. But somebody who doesn't have that kind of function in the brain will say, I don't know and I don't care. They'll cover up.
Okay.
So those would be sort of early signs. So how long it lasts, we don't know. The stages are the early, the middle, and then the end stage, and then the final stage. And in the early, that's kind of where we do a lot of covering up, and it's usually a slower, quicker stage. A slower stage is the middle stage.
Okay, so so we do know that when somebody, from when they're diagnosed, I mean, it's going to depend, but I mean, it is progressive, and it's not treatable. I mean, there are some things that we can talk about, but it's something that helping people to understand the different stages of the disease is going to help them to maybe manage it more effectively. I know that sometimes the family members don't understand, and it can be really hard to see someone that you've loved for a really, really long time. You know, maybe a spouse you've been married to for 50 years, and this person doesn't even recognize you anymore. Have you ever seen the movie The Notebook?
I did see that.
The Notebook, and it's about a love story about, at the end, you know, they'd been married so long, but every once in a while, the husband, you know, he was very loving to his wife once they were married, and then he never left her side. Like, he just, even though, you know, he kept holding on to that. I'm going to start crying. It's such a sad movie, but kept holding on to wanting her to remember him. And she, every once in a while she would, but I know that people that are watching right now probably experience things like that, and it's devastating.
It is devastating.
And sometimes they're not even nice to you anymore.
No, at some point they will treat you like anyone else, and you know, like a stranger or something like that. But the important thing, especially in the early stage, is it's really stressful for someone to say, don't you remember I just told you? Don't you remember that I did that yesterday? And you know somebody that has dementia, they don't need that. Just let them say what they want to say and just support them. That's really a kinder,
So
gentler
if
way
you
to handle it.
asked me 10 times what my name was, I would support you. I'd say, well, I'm Janet.
That's right.
I'm Janet, I'm your best friend,
Yes.
right? And talk to them, and you are so-and-so, and help them. I mean, because really, I mean, if they can't remember, then you have to talk to them in the present.
And
right?
sometimes they realize they don't remember. I've seen people who realize it, and they say, I know I've seen you before and I don't remember. And they fell down, and you say, how did you fall? And they said, oh, did I fall? And you know, how do you handle that? Because you don't want them to feel bad.
Yeah.
It just makes the anxiety go up, and they don't have the mental capacity to calm themselves down. So it's best to try to keep them calm to begin with, and don't get them upset about themselves. There are, like you said, there are glimpses, like in the notebook, there were glimpses of she's awake and aware, and then she goes back to her disease.
Yeah, I mean, sometimes they do recognize people. And, okay, so you said, you know, the first stage, right, this is the preliminary stage or whatever. Well, how does someone get diagnosed with dementia?
There are memory centers where they test people for dementia. It's really a battery of tests, and long questions and answer periods. And there is also a mini mental status exam that you can have done in the regular primary care provider's office, and there are about 12 questions there. The questions are, what is the date, what is the day, what is the month, what is the time of year, who is president. Something that trips people up often is math. Subtract 7 from 100 and go down as far as you can.
Okay.
So that's a really hard one.
Oh.
You try to get all of the answers right all the way through. They have you draw something, write a sentence, copy something, draw a clock, and then you get points for that. So the total number of points is 30 points. And we subtract what you could not do. So somebody who's got really mild cognitive impairment would maybe be 27 or 30. Or 28, something like that. You get into the moderate, you can be 25, 24, 23. That might be somebody who forgets to go to dinner, to have dinner. Somebody who forgets to change their clothes, doesn't feel like taking a shower, and they don't. So then we're getting down into lower numbers, and then that would be more of a middle stage of dementia.
Okay. So these tests, and you said that your physician could administer an exam like that, or your healthcare professional. There's a lot of websites and things that have these tests. I mean, should people just, I mean, do you feel like that's something that they should do if they can't remember?
If they
Their
want to do
best
some of those
friend?
tests, I'm not sure that they are
Yeah.
a good idea. If they're exercising their brain, that's a good idea.
Okay.
But maybe don't take those as diagnostic, those results as diagnostic. Take those results and go to your primary care provider
and talk things
talk
over
to
with
them.
them.
Say, "Do I
Especially if you
need-"
have a geriatrician.
Yeah.
They understand more of these issues. Okay, and then sometimes they may refer them to a neurologist, correct?
Usually a neurologist to evaluate why there's a change in the memory, because it could be other reasons. You know, there could be tumors, there could be infections, multiple sclerosis, or
Right.
Parkinson's, something else that's going on that makes it seem like their memory is impaired. Even a urinary tract infection, believe it or not, can do that.
And sometimes even when we think that, like you're talking about other problems like hypothyroidism or even a B12 deficiency, and these things, you know, sometimes if you have a person that drinks a lot of alcohol, right, we know that some of their B vitamins get depleted in different things, and maybe something's masking a B12 deficiency, which can affect you neurologically. So there's different
Absolutely.
things. So yeah, I mean, this is just making you more aware of some of the challenges that people have. We live here in Southwest Florida, and every once in a while I'll hear a story or something where somebody decided to go to the grocery store, and they drove their car all the way to Miami. They got lost, and they couldn't remember how to get home.
What
and
a frightening thing.
It's I can't imagine.
No.
You know, and in fact, that did happen to a patient, and he hit the rail and everything. He couldn't see the road. It just went on and on. So, yeah, so we want to make sure that people know where to get help if they need it. So that's good. And also, there's a great website, the American Alzheimer's Association. We have it up there. That's a great resource for information about signs and symptoms, things to look for, and different things. You can always get some helpful tips from there. Thank you, Rick. Okay, so you were talking about the early stage. Wanted to interject that there. And how people are just maybe forgetful, and then, you know, the person that's with them is recognizing, you know, that they maybe one thing that can happen, they can leave the stove on, forget they're turning off the stove and things like that. So with the very early part, they just think they're forgetting things?
They think they're forgetting things, but they're also getting a little worried. And these are the type of people that if you think you're having dementia, you want to cover it up. So that's what you're going to get at that stage. I didn't forget that. I know that. I didn't look. That's all.
Okay.
And so those, if you're having those kinds of things, I didn't forget to turn off the stove. You know.
Yeah, I left it on because I'm getting ready to cook something or
you
something
get an
like
excuse.
that. Okay.
Yeah.
Okay.
Or it's your fault that I left it on because you interrupted me.
Yeah, see, I'm
This fossil
distractible. I have
interactions.
ADD or something. Okay. Problems coming up with the right word or name, trouble remembering names. And honest to goodness, I mean, I just have a hard time remembering people's names. I remember their faces, but...
Well, have you always had that, though? Or is it something brand new?
Well, I think I have always had that problem. I mean...
So nothing's changed.
Thank goodness I remember what my daughter, you know, I mean, I'm just saying, but, you know, I think, don't you think that stress can play a role in this?
Oh, your brain can be overwhelmed by a packed schedule and too much stimulation and being too busy. And this time of year, we're busy here. We are. We're busy, even if we're not working, we're busy because the roads are so much busier, the stores are busy. So we're getting so much more input into our brain, so we're bound to get distracted.
And you think stress can play a role in that as well?
Definitely.
Okay, all right, that's encouraging. Okay, all right, now let's talk about, so you losing objects, you're forgetting people's names, these kind of things in the first part. What about moderate dementia?
So moderate, that's when we're getting into, we're forgetting what something is for.
Okay.
You know, that's where we're getting more
Eating
dependent.
utensils.
Yeah, and you don't want to get dressed. You're fighting hygiene.
Why do they do that? Why do patients do that?
They don't want to be bothered. They feel threatened. They don't want to be touched.
Maybe they think I mean, in some cases, and you correct me if I'm wrong, I mean, I know that I have some patients that don't want to eat because they think they just ate.
Yep. Or they eat again because they can't remember that they just ate.
And it's, I mean, and so it can work either way. So maybe the thing with dressing and grooming and things like that.
Yeah, they just don't, you think about it as kind of going back down the hill after getting older, and you go back down to that baby, toddler level, and they want to be rebellious. They just don't want to be bothered. They don't want to get up in the morning. So that's kind of what's happening to the brain. It's shrinking back.
Okay.
Down.
Okay. So the brain is actually shrinking throughout this entire process.
Yes.
Okay. All right. And let's see. Okay. So they will forget events, feel moody, withdrawn, and confused about where they are.
They can get aggressive at that point too, because if you know, it depends on your approach with them, but sometimes they just get anxious and depressed. And you wonder if maybe, and we don't know, wonder if maybe they're becoming aware that this is happening to them and they get depressed and angry about it, and then you just happen to come on the scene, you're going to get it. So they can get angry. Not all of them do, not everybody does. And I've seen the people that were high-powered, you know, type A professionals, when they get dementia, they just get sweet as sugar.
Really?
And I've seen the sweetest little old ladies who have these episodes of, taking their clothes off and yelling and
Agitation.
screaming. And
Okay. So there's really
Unpredictable.
it's unpredictable. I mean, you can start up, and that's kind of what I see sometimes is that, you have these couples and they've been married for 50 years. And obviously to be married 50 years, you must have been doing something right? And then when this lady sees her husband come, she's cussing at him, making comments, and one time I had a patient, I was talking to her husband on the phone, and just talking about she wasn't really eating that much and stuff, and then she was sitting there when I was talking to him. She's like, I can't remember exactly, sorry, but anyway, I just remember that she was asking me, well, did you call my dad? And I said I did, because again, I'm trying to,
keep the calm.
keep her calm. I'm like, I did have a nice talk with your dad, and then I told her, your dad told me to tell you he's coming here in a little bit.
We become good liars just to keep everybody calm.
Really, to keep her calm, and telling her, no, I didn't call her dad, was going to get her agitated or whatever, but I'm like, yeah, he's actually coming here, and it was actually her husband, right?
Yeah.
But she gets him mixed up with her dad. So when her husband came, now this is a lesson to me, when her husband came, which, right, she thinks is her dad, the same person. When he came, I said, well, I'm so glad your dad showed up to see you. She's like, honey, that's not my dad. That's my husband. So
you can't win. You try. You can't win.
So I'm like, oh, right. I see that now.
Yes, that's all. I was wrong.
Yeah, and she, I really loved her. She was a cute lady, but yeah, and she, at one time, she used to be like the manager of a office business, sometimes she'll tell people, she's like, I'm the boss here, if you're not doing your job, I'm not going to give you a paycheck.
Oh,
so
yeah.
it's really kind of, but at times, I can't imagine how sometimes they are afraid. And I think sometimes even shadows and different things at nighttime can scare them. And
yeah, they can become psychotic. Something that's interesting is that if the floor changes color, so we're walking on a white floor and maybe there's a black stripe on it, they'll get just petrified. They can't figure that out, they shouldn't go across. They'll be really, really scared to go across, that there's water or a vast hole there or something.
They can't.
Very afraid of that. So, it's almost become psychotic because they can't interpret their surroundings anymore.
Wow. Okay. All right. Now, so what about people that say, like, there's a lady, Dr. Mary Newport, she wrote a book about Alzheimer's and if coconut oil can cure Alzheimer's.
Wouldn't that be wonderful? There are studies on things like that, like coconut oil, and that study, they actually improved their cognitive function for a short period of time. Maybe they were getting more attention just then. Maybe they were getting a little bit more cognitive stimulation, and they seem to do a little better. There have been studies with vitamin E that has not been proven to do anything.
That coconut oil, the lady that wrote the book, really, she was a doctor, and her husband was diagnosed with dementia, Alzheimer's, and so she had basically read about the research with ketones and different things, and medium chain triglycerides, which is what coconut oil is, and there was really no conclusive evidence to support that. What I like about the Alzheimer's Foundation is that the information they have, a editorial scientific board on there, doctors and people that actually study what can help. And we know that there are some things out there that are just not making a difference. Like there's all kinds of brain supplements, right? And
yeah, vitamin B12, but you get tested for that. If you're low in it,
Yeah.
If your blood level is low in that, then sure, it might help your thinking, but then is it really dementia? So we can't take these things if they're not needed in our bodies, and we can overwhelm
And
our body
sometimes they
with
can
the
be
wrong
harmful.
things.
What about for people that, you know, that are diagnosed with dementia or Alzheimer's? Do you recommend that being a good time for them to do any type of advanced directive?
They should do that while they're still competent. So if you have some early signs of memory loss, do all that. Make all those plans.
Okay.
Do all that then. It's sort of like being diagnosed with cancer. Do everything just in case.
Okay.
Be prepared.
Yeah.
Because later on you're not going to be able to do
have
it.
the capacity to
One
do
lady
that.
was diagnosed and she said, I'm writing a book and I really want to write about my travels in Ireland and I really want to finish this book, and now I've got this diagnosis. And I said, write the last chapter.
Oh,
You can
wow.
always fill in the other
Yeah,
as you
that's
can,
great.
but right now, write the last chapter.
And then we know that dietary-wise, that anything that's good for the heart, right, is also good for the mind. And the mind diet, we've talked about this on the show before, but basically the mind diet is a healthy diet that is kind of like a combination of the DASH diet, dietary approaches to stop hypertension, along with the Mediterranean diet. It includes whole grains, nuts, berries, salad, green leafy vegetables, olive oil, things like that, which we know are healthy for us. And you know, so the more that you consume those, the less likely you are to have some type of dementia component. I mean, that's the best thing you can do. We know that there are some medications that are used to help.
Yeah, we have Aricept, Namenda, and Exelon. We just have a few medications. They may bring the person up to a little bit improved level and hold them there a little while, but as far as the disease is going, it's progressing. And when they get into the moderate and then the end stage, there's, especially in the end stage, no reason to have those medications anymore. They're not working.
And we do know that, you know, if you are someone that likes to learning a new language, doing crossword puzzles, they're staying busy and you know, keeping your mind active, and then physical activity, all of those are very helpful in helping keep your mind healthy. So these are things that you can do. You know, time always flies when you're having fun. And I do refer to that website. If you're looking for more information, go there. I want to thank you for being on the show today. Always so much information. And thank you for tuning in. I hope you found today helpful for you.